Yeah, I want to thank Letha, and you're right. I mean, PopTech has been is parenthetically framing my career over the last 12 years when I was a fellow in 2010, I believe. And now today, after the pandemic, we've spent the last couple of years, I think, validating some of the hypotheses that I was thinking about in those early days. One of them I show in this image. We've spent these last couple of years separated 6 feet apart. It's nice to see everybody sitting next to each other with a little bit of comfort in being together. That 6 feet apart rule was a really interesting reminder for me because I'm an architect by training, and I think about that 6 feet apart rule not as a strategy to keep distance between us, but it's actually a strategy to estimate the volume of air around you that we're trying to design for. And we kind of transformed our communities around this 6 feet apart rule. We weren't really doing the work to visualize what we were trying to solve for, which was the air around us, which was keeping us from breathing uncontaminated, fresh air, keeping us sick, affecting our health. I think the one thing that really I felt validated by thinking is that the buildings around us, we learned this in the pandemic, the buildings around us are actually shaping our ability to breathe and giving us or keeping access for health from us. And this is the case everywhere in the world. It might be the housing that you live in or the nursing home where your window's no longer open. It might be that kind of soulless office bay that you live in or sit in all day and there's no light, there's no air. It might be the housing project or your residential community that's next to a factory or a highway. Or even recently, dormitories that are being designed and built. This is in California, a new dormitory that's being designed, which has 94% of the rooms have no windows. It was inspired by cruise ships as the inspiration, and they have little lights to sort of estimate daytime. Not surprising, this is having a huge effect on the mental health of students. This is in Austin, actually, where there's another dormitory being designed with the same strategy in mind. Fortunately, there's a small but growing movement to resist and also calculate and quantify the negative health, physical, mental, and social health impacts of the buildings that are being designed to sort of stuff as many people in as possible without consideration of the most basic things we need, which are light and air and spaces that give us dignity and protect us. It shouldn't be surprising, actually, that buildings shape our lives. They shape our health and our behavior. We spend 90% of our lives in them. 90%. The spaces around us, how could they not be shaping us? How could they not be affecting us, impacting us, changing the way we think, changing the way we get access to things like our health? So the question has to be, especially after the pandemic, where that has become sort of so evident, there's real proof that the buildings are shaping our lives. The buildings are actually keeping us from breathing. What can we do to change that? Are there strategies to both design a way out of this crisis, or are there ways that we can look backwards to see examples of where that worked before, and we might replicate them or retrofit the spaces around us to do so? Fortunately, there are pathways, and in fact, we used to think about buildings as directly affecting our health. This is the great Florence Nightingale, who in 1859 studied a hospital during the Crimean War that was designed to maximize light, air, and the movement of air. It was an army hospital where soldiers were dying at an enormous rate, and yet when put into this newly designed hospital by the great structural engineer Isambard Kingdom Brunel, one of the great names of all time, actually, the rate of soldiers dying in this new hospital dropped by 70%, 70%, just by getting air movement, getting the soldiers off the ground. It's an incredible data point, and one that inspired Nightingale to put those ideas down in her book, Notes on Hospitals, which we will see there, which was then published and spread all over the world, and it really transformed the way we think about our built environment directly, that it should be designed to shape our health, that it should be designed to improve our health. These ideas didn't just shape all hospitals that were being designed and thought about, which it certainly did. It also shaped schools, and this is the outdoor school movement, which I will, after the Spanish influenza in 1919, a big movement in architecture was to say, well, if kids are getting sick in classrooms, and we know that happens during flu season already. What if we just take away the walls, open up the walls, open the windows, create schools that are surrounding courtyards? This was both a medical movement, but also an architectural movement, one that we tried to implement again during this recent pandemic and had a lot of resistance. We could have just put students outside. This happened in factories where, because of the limited amount of electricity in many American factories, this is an image of Mass Mocha in North Adams, Massachusetts. Yes, we thank Ethan for this. You might know that these old brick factories were designed with huge windows so that we could get a generous light and air into the interior to support labor that was working at the period of time. But there's also intelligence behind that basic, simple strategy of light and air that we now are desiring to be reintroduced into our buildings. Even the modern movement and architectural movements in the turn of the century, like the Gamble House here, were designed around healthcare in mind. This was designed, Pasadena was thought of as a place to go at this period of time to get the cure, or to get healthy, to remove oneself from the dangers of the city, to avoid things like tuberculosis and disease. And then the housing around it, of course, this is more than just health, but it's about generous outdoor spaces, sleeping porches, landscape. It's about sumptuous materials and beauty. It's about using the places in which we live and thinking about the architecture really intricately so that it's shaping our entire self, our entire well-being, and of course, our physical health as well. Of course, this all changes in the mid-century when we have a new device. Indoor air conditioning really starts to be available everywhere. Its price point goes down and we can implement it, and we can now transform indoor environments around comfort, which is a benefit for many places, especially those that are uncomfortable. But what that does is actually transform the entire building stock of our world. Instead of open and airy, windows become small and sealed. Instead of natural fresh air, we're breathing recycled, sometimes contaminated air with very few air changes per hour. And it's defined by the technology that wraps and is part of the building itself. This is the Centre Pompidou, which of course is a great example of just making visible all of the systems which now are necessary to run the infrastructure we live within. And this was sort of my experience too. When I was a student of architecture, my father, who was sick with cancer, was brought to a hospital to save his life. And I walked into this hospital, which with this plan has this sort of endless hallway without any windows or light that you can see. And I was kind of transfixed on why, even though they did extend his life, why the experience was so undignified. Where was the light? Where was the air? This moment of transition in his life, this incredibly stressful period where we all at one point will go through this, where was the design that I was learning about? Why wasn't it there in the everyday? Fortunately, there are people that are trying to think about this, to try to transform this and make that experience, both of our lived experience, but also of our health, much, much more improved for the buildings around us. This is the great Thomas Heatherwick, whose Maggie's Center is a cancer center built in England, which is really about turning the building inside out and bringing people outside. I wish my father was able to get his cancer treatment in a space like this. There's historic precedents like the great Charles Correa's tower in Mumbai, which is a tower, residential tower designed with these really innovative outdoor porches that are 2 stories, which drive fresh air through every single apartment unit, front to back. A model which was built in the 70s and could be replicated anywhere. It's brilliant and for a very humid climate. Or even just thinking about the innovation that happened during the pandemic when restaurants, we couldn't sit in restaurants because there were contaminated air with very low circulation of air changes per hour. So the public needed its spaces to convene, and so they pushed outside, took over the streets, and improved our cities everywhere we looked, reawakening the possibility that we could see a window into a city we want to live in. It could actually be a place which actually serves our everyday needs and thinks about airflow. This is really an airflow strategy. We didn't think about it that way, but it is, because it was too contaminating inside. In my own work, at the group I founded and led, Mass Design Group, we had been thinking about this early days. In my first PopTech speech in 2010, we built this Butaro hospital with the great Dr. Paul Farmer, and the issue in northern Rwanda at that period of time was that we didn't have the money for air conditioning. We didn't have the money for mechanical systems. So how do we make the building breathe so that we could reduce, at that time, multi-drug resistant tuberculosis a disease that's contaminated through the air. But of course, those same strategies work for COVID-19 and other future pandemic diseases that are airborne. So we just turned the hospital inside out and made it get enough air changes per hour that could actually reduce TB. And those same strategies turn out to be very necessary for the way we might rethink our infrastructure today. This most recent hospital we finished also in Rwanda is a taller building in an urban setting. So we were thinking about the hallways as a structure that could wrap the building itself and that therefore insist that there's always a barrier of airflow for the patients that are sitting in there, and they can sit outside, walk outside, be wrapped in a sort of garden as well, but always be protected through airflow. In a most recent project in my hometown of Poughkeepsie, New York, one of the fringe or legacy cities that Ethan talked about, we took this old abandoned warehouse, which had been sitting vacant for many, many years, whose windows were bricked in so that they could put air conditioning in it. And just by opening up those same windows, by reinvigorating the kind of original idea of the project, we're able to actually totally create a carbon neutral building at day one and an innovative new air handling system that's non-centralized. So we're getting fresh, uncontaminated air into this building from each of these new window units without a centralized system. So it's an incredible innovation, just kind of rethinking that old structure and making it work better for today's needs. Two other things I'll talk about. This was during the height of the pandemic. The researchers from Mount Sinai Hospital in New York in April 2020 were dealing with the outbreak in New York, and they were actively reconstructing and reconfiguring the spaces that they were working in and not knowing who was getting sick and where the most contaminated spaces were. So I worked with them to think about what we call spatial literacy, so they could sort of map out more directly through simple strategies with like crayons and fire exit maps where the most contaminated spaces would be, so they could help their doctors and nursing and administration to know what's the most contaminated areas and how to protect themselves. And not surprisingly, they made a decision, which was to move the COVID patients out of the new contemporary bed tower and put them in the 1930s bed tower, which had windows that were operable. So they could retrofit those spaces and the patients could be healthier. Fascinating move, but also I think illustrative of the problem that we're facing with legacy infrastructure. And finally, my students at MIT, we worked during the pandemic on rethinking all of the schools around Cambridge. And each student picked a school and tried to figure out how to retrofit it so that it could get that natural ventilation and reintroduce the kind of open school movement back into existing legacy infrastructure while we were working on the policy of how students would return to school or do virtual with the Cambridge school district itself. You know, one of the big arguments was, again, as I said, keep students at the school designed for health, not for comfort. Health first, then comfort. Instead, we designed for comfort first and not health. And I think that created one of the crises that we're seeing today around this lost generation of education of our students. I think finally, you know, breathing is not just about our physical sense. It's also not something that's equally shared. It's a right that isn't equally shared. We know that from the BLM protests and also this incredible, it's not surprising to me that this became the rallying cry, right? That breathing is something that we don't all do equally. And Brian Stevenson, the great Brian Stevenson, the Equal Justice Initiative, talks about the problem of racism in America is, he calls it a toxic smog, this thing that we all breathe and we can't escape. And so when I worked with him on the new National Memorial for Peace and Justice, the National Lynching Memorial, it was very much in the metaphor and the language of health. It was very much about how do we solve our crisis of racial terror, racial difference, and difference between people? How do we end the suffocating experience of living in America and actually create spaces, infrastructure that allow us to breathe more effectively as individuals with each other? This is very much the case of this memorial, and I feel like these spaces are being advocated for more, both to heal our nation and heal our nation's challenges, but also insert in the community crucial pieces of infrastructure that think about breathing holistically from our bodies to our communities, to our climate, to our national sense of self. You know, in the end, I think breathing as a lens through which we understand our built environment might be one way to push forward post-pandemic and ask, how can we take agency over the experiences around us? I see people in these places transformed. I see patients who feel a sense of dignity. I see workers who feel seen and heard. But I also I think we've experienced that kind of collectively, the suffocating challenges of a built environment not deserved for our needs. We've felt the fear of that suffocation and going into buildings, masked or unmasked, not knowing what's happening with the air movement or whether it's a dangerous space. But we've also seen and witnessed the possibility. We've opened a window into the possibility of redemption and the possibility of a built environment that serves our needs directly. And I think it gives us a pathway and towards what we might demand as a public. I think there's three things we could really think about. First, you and the public, you can say, this air around us, this is my environment. We can demand that we think about this indoor air environment as something we can control, demand, and ask of each other to change so that we can have metrics improve that it's protecting us. I think we as architects can be forced to think about breathability and health as a primary metric that we're aiming towards, like the great Florence Nightingale did. And I think like Florence Nightingale, we can look back at all as a public and see these buildings not as fixed piles of rubble and stone and braced wood. No, these are living systems. They're mechanisms that shape us every day and can improve our lives, but also can harm us. And if we don't fight for the former, we lose an opportunity to transform the communities around us. Thank you very much.